program, we can have dessert and some more mingling. So I'd like to introduce Dr. Thomas Crassas. As you well know, he is the owner and operator at Philoptochos Therapy. Many of us have been his patients or are his patients, so he's going to talk to us about arthritis. And give him a round of applause.
So thank you guys so much for having me. I appreciate the opportunity to come and talk about arthritis. It's something that we see often at the clinic, and definitely want to just go over some information for some patients, as well as just talk about some case scenarios. So our motto that we go by is that you don't have to live in pain unnecessarily. So if there's something that we can do about it, that's always our goal, is to try to either eliminate it or at least make something better. It doesn't have to be arthritis, pretty much anything, but we're going to focus in on arthritis today. Can everybody hear me okay? All right. So I want to start with a couple case scenarios, actually. So we have a 50-year-old female who presented to the clinic with low back pain. She had pain for 21 years coming into the clinic. So it was a very long-standing. It actually started after she had her, I think it was her third child. She went to doctors in South Carolina, went to doctors here. She was actually going to travel to Germany. And the final diagnosis that they gave her of all of her pain, she couldn't sit, she couldn't stand, she couldn't walk, was arthritis. They said, you have arthritis, this is your issue. So we're going to circle back at the end and talk about some of this stuff, but a teaser for that one, she did leave pain-free and be able to live and function as a normal human being, going out, seeing her family. She actually, at one point in one of her treatments, was a pretty extensive treatment. She emailed me, said that was the first time in 3 years that she was able to sit down and watch an entire movie with her family. So we'll talk a little bit about some of these things at the end. There's another patient, 78-year-old female. She was actually presenting to our clinic because she was about to go in for a total knee replacement. They said, go to physical therapy just so you get stronger, because there's research out there that the stronger you are going into physical therapy, into surgery, the better your outcomes are. So she was just coming to just get strong before surgery, go pretty much get the surgery, then come back to physical therapy. And again, thank God, we're actually about to discharge her now. She is not having symptoms. So, third patient, so we're talking about a low back patient, diagnosis arthritis. Then the last patient was knee, so total knee replacement, diagnosis arthritis. This gentleman, 66-year-old male, headaches for about a year, neck pain, headaches, couldn't turn his neck to the side, said sometimes they sleep funny, that they just can't turn their head. So this patient presented with a diagnosis of, can you guys guess? Arthritis, anyone? Arthritis, there you go. So they took an x-ray, it showed that he had arthritis. By the end of treatment, full range of motion, again, very limited pain, if anything, and be able to go back to functional things. So the reason I bring up these case scenarios, we're going to talk about at the very end what each one we did in order to address that, is because a lot of times arthritis is there, and when people hear arthritis, they say, oh my gosh, this is it, this is only going to be going down from here, but there's just so much that can be done, that we can do, that you can do, that pretty much that everybody can collaborate together to address the issues that are causing the pain. So the goal is not just figuring out the diagnosis, because the diagnosis of arthritis is very easy. You take an x-ray, you see stuff, there's arthritis. But what's actually the pain generator from that arthritis? So the pain generator is, you could have muscular guarding, you could have hip pain that's associated with tightness within the capsule. So there's so many things that drive pain, but the diagnosis will be arthritis. So what we're going to talk about today is 4 things. So, 1, what is arthritis? 2, the importance of flexibility in arthritis, and we'll talk about joint-specific things. 3, strength training and how that affects arthritis. And 4, we're going to touch on this because I think this is a very important part that often gets overlooked, is nutrition as it relates to arthritis. I think that's a lot of times we get questions about that, what else can I do? I'm doing my strength, I'm doing this stuff. So they talk about what nutrition. So we'll talk about a couple supplements, a couple different dietary things. Again, we'll just touch on that. So number 1, what is arthritis? So I'm going to pose that to the crowd here first. So, does anybody want to take a stab at it? I'm going to pick on Zoe a lot because I know now she's a 5th year. But anybody but Zoe want to say what they think arthritis is?
Fluid from the joint?
So yep, very close, very close. You can get fluid in the joint, like swelling of the joint.
Inflammation, deterioration of the joint.
Yep, exactly, of the joint. And very specifically, and those are both great answers, it's the joint cartilage. So the way I stand here is my knee has articular cartilage attached to the long bone at the very end. So articular is like articulation, where they come together. That's the joint. So the cartilage is not innervated, meaning it does not have nerve supply back to your brain, which is great, because if it had nerve supply, nobody could stand ever, because that's what happens with the breakdown of that cartilage. The bone has lots of little nerves, so you get a lot of feedback to your brain. So the way the cartilage is, I'm just going to put this down real quick. The cartilage, can everybody hear me? Basically, it's at the end of a long bone, okay? So then when you put pressure onto it, cartilage here, you don't have that feedback back to your brain that there's pain, because the cartilage doesn't have those nerve fibers. But when you break cartilage down, it creates some swelling, inflammation. That's the inflammation kind of component. What will happen is that breakdown of cartilage, now you have direct contact on bone. So everybody heard of bone on bone? Like that's the big thing. Bone on bone is breakdown of cartilage on both sides of the long bone, or one side, and now you have pressure onto that area. When you have pressure onto that area, that's highly innervated if it's bony structure. And that's why people say, oh, that's bone on bone, it's broken down. So there's a lot of things that we can do to distribute the forces away from that quote-unquote bone-on-bone distribution. Does all that make sense for what actually arthritis is there? All right, so with that breakdown, we're going to talk about flexibility. So this is going to be an important concept to get. So anytime that there is any type of injury, what will occur is everything tightens up around that area. Your body goes into a protective mechanism. So your muscles will tighten up, it gets inflamed. The analogy I use is inflammation is like Elmer's glue. So your body's trying to heal it. Like if you ever have a cut on your arm and your body's sending inflammation into that area to heal it, and kind of sticky, that gooey, that's what happens in your joints. So we'll use your knee joint, your hip joint, neck, back, all these joints get a little stickier. The problem with that is now you have much more compression in addition to the breakdown of the cartilage. So the analogy I like to use, again, I'm going to use this or lose this, is so if I have my fingertip, so my eye is very sensitive. Everybody's eyes are sensitive. So, and if anybody has any arthritic change, they have sensitivity in those spots. If I have my fingertip and I'm poking myself right in the eye constantly with compression constantly, that's going to cause a lot more pain than if, of course, I had some of the pressure off of it. So I can still have the sensitivity in my eye, but when things tighten up, the compression goes right through one spot. And if it's the area that's exposed, that bone on bone or that bony segment that's exposed that has high innervation, meaning feedback back to your brain, that's going to hurt a lot more. So the goal is you want to create flexibility within that area. So instead of having a finger in my eye, and I use this analogy because people can all understand a finger in my eye, you distribute the forces so it's distributed more throughout, so it's not just one spot that's sensitive that's getting all the pressure. So you do this, that hurts a lot less than this. Does that make sense? It's still pressure on that area because we're all going to stand, walk, move around, but it's less isolated pressure. So if there was a request to get people up and exercising, we might do that a little bit at the end. I'll let everybody finish, but there's flexibility things that you can do for every joint segment. So if it's the knee, you want to make sure that the quad muscles are flexible, the hamstring muscles are flexible, the calf muscles are flexible, because all those muscles cross the knee, and if they're tight, what's going to happen is, here's a nice little spacing in there, they're tight, and you also have breakdown, they're just going to make that breakdown even worse. And if you have one spot that's causing you more pain, that's going to create more pain and pressure into that area. So now you're doing pain here, more pressure, and then you don't have stability, because we'll talk about that next, and that's just constantly just breaking down there. Any questions on that right now? All right, so that kind of begs the question of, okay, so now we get mobility, say we do some joint mobility techniques, some soft tissue massage, because the benefit of soft tissue massage is to loosen up the muscles into that area, stretch the muscles, make sure the capsule is moving. Then what do we do from there? So if you have good mobility without stability, without strength, what will happen is you're going to get friction. So friction without stability, I'm going to use my ring as an example. If I just kept doing this with my ring on here, what's going to happen? I'm going to get more wear and tear in here. And guess what? My arthritis is going to progress. Anything that wears and tears, compression, more friction without stability, you're going to get much, much more of that breakdown of that cartilage. So Zoe, if you don't mind, I'm going to bring you up here as an example here. So we're going to talk about strengthening. We're going to talk about the importance of strengthening for the benefit of arthritis. So thank you so much. So there's interesting research out there. I'm gonna actually throw this out there for pounds of pressure. So our spine is in a form for shock absorption, right? So it kind of has specific curves in there. So without muscles, guess how much force, mind if I put my hand on your head here? If I put force down just like this and push down on Zoe here, how much force am I gonna have to generate if she had no muscular stability to collapse her spine? How much? How many pounds? It's actually very interesting.
20.
Very close. Getting closer, 5 pounds. I think it's like 4.7. So 4.7 pounds of pressure to collapse her spine here. If I just applied that, and if they actually threw cadaver lab, they basically took the muscles off, had the spine there, generated a load straight through, 5 pounds. So what the muscles do, that people always think about core strength, they think about, okay, they say I need to be strong, but what does that actually even really mean? What the muscles do is they create basically stability from the front, stability to the back, and something called like tensegrity, almost like, if anybody's an architect, anybody an architect in here? All right, that means I can be okay and not butcher something. But it's basically, the way that it works is there's tension on the beams, there's tension from the muscular force, and this force allows you to put pressure, and then instead of collapsing here, these muscles will kick in. Then collapsing this way, these muscles will kick in. Same thing happens at the knee, same thing happens at the hip, same thing happens at the spine. So what it is if you're having the force that comes down on you, your muscles are going to be what prevents you from having more of that compression, and also eliminates a lot of that shear. So people think, oh, it's bone on bone. Just every time I put pressure on there, if their muscles aren't working and they're not flexible enough, what will occur is they'll just collapse down, and it'll just cause more compression. And then that's when people hear arthritis. Oh, that's it. That's it for me. They said I have arthritis. Everybody after the age of 35, I think it's like 80% of the population, if you image their body, they're going to have some level of arthritis. It's just in all of us. The goal is to reduce the line like this to be like this. And the way you do that is through the strength training. Thank you so much. Any questions on that at this point? All right. So we talked about flexibility, we talked about strength training. We're going to touch on nutrition in arthritis. So when I asked the group earlier about what is arthritis, we talked about inflammation. So there are certain people that have not just my knee hurts, my hip hurts. They say, my knee hurts, my hips hurt, my knees hurt, my ankles hurt, my elbows hurt. I just feel like just everything hurts throughout the day. And in the morning I'm more stiff. That's a common thing with arthritis because your body's a little bit more inflamed and you're stiffer because you're not moving, so that fluid kind of doesn't move around. So their joints are a lot more stiff. So in those patient scenarios, and the reason I bring this up is because I feel that it's just such an important information to kind of share with people, because sometimes it gets missed under the radar because we look only at the musculoskeletal system, is nutrition can impact how our bodies feel. So I've had a patient, again, I'm going to use another patient scenario, this is not of these three, I'll get into more detail of these three. Has everybody heard of fibromyalgia? So it's pain all over your body. So this patient presented 3 or 4 months with our therapy clinic, at a clinic I used to work at in Lancaster. No change in symptoms. He had fibromyalgia, pain in his entire body for 11 years. It was after he had IV antibiotics. It messed up his gut. He didn't really think about it. He just got diagnosed with fibromyalgia. He had pain in the back, pain in the neck, pain in the hips, pain in the knees. Just everything was unfortunately wrecked for this gentleman. So 3 months of PT, they said, no, there's no change in his symptoms whatsoever. So one of my therapist colleagues said, hey, can you talk to him about some nutrition stuff, take a look at some things. So we looked at his case, and he had basically on-the-road job. He would just basically take all processed packaged stuff to eat pretty much all day long because he was on the road. That's what he had to do. That's all he could do. So we did an elimination diet. The 7 major food groups that cause inflammation, hopefully I remember them here, that not necessarily for everybody, but these are the most common groups that cause inflammation in people in general that have the antigen that your immune system responds to. It's gluten, dairy, soy, peanuts, corn, shellfish, and eggs. So that's not to say that everybody responds to all of them, but if somebody presents like this gentleman, and he was very dedicated because his life was down to literally significant pain every single day. We cut it out for 30 days, those 7 food groups, and had him go on a whole foods diet. Within 30 days, his pain was 50% gone. Within 2 months, his pain was 80% gone. By 3 months, he was gone, pain-free, 100%. And he just emailed me, just for the holidays. He's like, hey, just letting you know, like, just want to let you know I'm still pain-free, I'm feeling good. Just want to let you know, this was literally like 6 years ago. This was 6 or 7 years ago. So there's a huge component to what we put in our bodies. If our body's responding with inflammation, that can affect inflammation of the joints. That's a huge, huge component. So, yes?
Did you say was the first one gluten and the last one was eggs?
Yes, those, and just to clarify.
Bread and eggs.
Bread and eggs. So, just for clarification, that is 100% accurate, and that's a common thing. It's not that all 7 of these food groups everybody reacts to. So, for clarification, because this is a very important part, so for him, it was probably only 2 or 3. You can bring things back into your diet that allows you to have a wide variety of foods, but what that does is it helps you to determine what's driving it. So what we did with him is we cut out all 7, he brought food groups back into his diet, and he felt much, much better there. But he needed to kind of figure out what it is. So for some people it's gluten, some people it's gluten and dairy, some people it's just soy, some people it's just corn. But those 7 food groups are the most reactive for our immune systems. Not necessarily for everybody. Each person is different. Does that all make sense? Because I don't want people to be like, I'm afraid of food. That'd be terrible.
What about sugar?
Sugar is very inflammatory in nature, 100%.
That's not part of your sentence.
So sugar is inflammatory, but it's not necessarily on the food. So I actually, as part of it, yeah, because you're eating all whole foods, you're going to be cutting out processed sugar. But sugar is not necessarily one of the antigens that your body's immune system reacts to, like those 7 major food groups. However, sugar is inflammatory in nature and can cause, again, all this stuff. So people that go on this, they cut out sugar and they cut off all processed stuff, just for again, 30 days. And I apologize in advance if anybody's spouse is going to make them go on this. I'm just looking over here to start. I apologize. I just saw it in his eyes. Sugar actually is good for you. Especially if it's in mukumadas and desserts. Anything else, not good. Sorry, Chris. But yeah, so, and then there's a couple other things. So, I just want to, again, share that with people, not necessarily make drastic changes, but if you aren't finding answers in traditional, and you're like, I just got to figure out what the heck could be driving some more of this, that is helpful to know, at least in the back of your mind, that there could be something that is creating inflammation in your system there. Quick thing on supplements, 3 or 4 major supplements that people like to ask, hey, what supplements can I have? Because people are trying everything just to get out of their situation. Curcumin, which is a component of turmeric. The best product out there that I see is Thorn. So Thorn, it came from one of my courses. It helps with reducing systemic inflammation. Resveratrol is another one that's very helpful. Resveratrol, again, I think it's found in like the red wine. So wine, there you go. You can still do that. Yeah, there you go. I'm trying to help people out here. And then omega-3, so like fish oils, omega-3 fatty acids, it's very good as a joint lubricant. And then people always ask about the glucosamine, chondroitin, MSM mix, because that's like the most marketed one out there. The documented research out there that says it helps, they just can't say that it specifically helps to kind of grow back that cartilage. But it does help. People say it does help. The research says it does help. So I just wanted to share that. And then for purposes, not for this, because again, I'm taking more of the physical therapy angle, but from a medical angle, there's other options too, and I'm just going to throw them out there just for people. Like the cortisone shots sometimes do help to kind of, they hit it just right to help reducing some of that inflammation into certain areas. The others are that Cinevesc or Euflexa. Basically, it's an injection to help in the knee that helps with kind of almost like acting as a brake pad, just kind of lift it up. There's other research out there with stem cells that's kind of new and upcoming that people like. PRP, it's plasma-rich platelets. Again, just giving all this just in case you go to your doctor. It's not the first time you hear about it. But all those are other options to taking care of or addressing some of the components of arthritis. All right? So we're going to circle back and review those 3 cases and what we actually did based on some of the concepts that we just went over. Before we do that, any questions on any of that stuff there? Good? All right. So, first case, 54-year-old female. That was the one who, for 21 years, she was having low back pain, couldn't sit, couldn't stand. So when we assessed her, her diagnosis was specifically SI joint arthritis. She was going to go to Germany to have a fusion specialized, but the doctor looked at her record and said, we're not going to do it. So she's like, I don't really know what to do. And luckily, we just kind of ran into each other for a separate injury. We addressed the back. And what it was is she had her piriformis muscle, which is a hip external rotator, locked and holding her sacrum, which is this bone here, into a rotated position. So basically, she was like this, and she would wake up crooked every single day because the muscle was locked. So then when she would sit, it would pull on that muscle. When she would stand, it would pull on that muscle. So the thing that we did that day, she emailed and said it was the first time in 3 years that she was able to sit and watch the movie with her family. So she was prone on her belly. We did a release that literally took about 2 to 3 minutes of that piriformis muscle. So the concept of improving mobility so you're not having compression is perfect. So again, Zoe, if you could come back up here one last time. So her muscle was in here, the piriformis. We're going to use biceps. People typically know biceps. So go ahead and bend your arm here. So she's going to be like this constantly for years. How would that feel? How would that feel for all the structures in here? You're not going to get good blood flow. You're going to be in this position where you're just guarded constantly. That was what was happening in her low back. So if you have that compression, what do you think it can do to her elbow? She's not going to get good joint mobility, so she's not going to get nutrition into that area. So if she's stuck like this, like that patient was with her sacrum, you have to get joint mobility. And we actually tried strengthening before. It didn't work because she was so locked up. So you had to get that joint mobility. You got to get both. You have to get both. Thank you. So once we released that, then we got her on a strengthening program, and she was able to be at her kid's wedding, doing all this stuff, planning the wedding, all that stuff. So all that good stuff that you hear, that's like, oh, thank God, it chose his career. It makes all the not great days work out. So, second thing, the 78-year-old patient, a total knee that she was about to get a total knee replacement. When I asked her to come into the clinic, I said, go and line her back, we're going to lift your leg. She basically was shaking. Just to even lift her leg, she literally had no strength, no shock absorption in those muscles to allow less compression through the joint. So if she had no strength through those muscles, and she didn't have mobility either, but the strength was a big thing for her because once we got her stronger, she got much better. What do you think was happening all day long? It takes 5 pounds of pressure to collapse the spine. So what do you think is happening at the knee when she's walking, when she's doing all that? So again, thank God we gave her on a very good hip stability program. So for hip arthritis, that helps out very, very much as well. Quads, hamstrings, and we basically went through a pretty comprehensive stability strengthening program, and she did much better. And again, thank God is going to be discharged pain-free. God willing, she continues there. Lastly, the headaches. We see lots of headaches. That's my big thing, that I don't want people that have headaches unnecessarily, because usually it's restrictions within the neck. There's somebody out in the crew that it won't breach confidentiality, because they're my kid, but they get headaches sometimes from neck stuff. So I think it's one of those things that people just think, oh, I just have headaches. It just kind of just comes and goes. It's just what it is. You got to figure out sometimes if it is coming from the neck. A lot of times you'll get a diagnosis of arthritis or just the neck being tight. So what we did for him is we did a similar thing for the first person, but what we did is we unlocked the muscles in the neck for this gentleman, and then we allowed not necessarily just the muscle, but we got the joints moving well, because when you turn your head, your joints need to glide up and down on both sides. If you cannot turn your head, something is being blocked, so it's just not allowing you to move. So we went in, addressed the restrictions of the muscles, kind of gapped the joint, and then afterwards we taught him a stability-based program there. So after the stability, you get that motion, then you do well. So those are the 3 examples that we started with to kind of tie up what we actually work on with arthritis. Yes, sir?
How old was that last team?
I'm so sorry, did you hear me?
How old was the last?
They were mid-60s, mid to upper 60s.
Okay.
Yep, mid to upper 60s. Arthritis. We see these patients too with headaches that are from 8 to 80. It's very, very common. It's very common. You have to look at the neck though. It's so common. If somebody has headaches, and look at the neck, and also, again, not to get off on a tangent, but their shoulder as well. Because if they have a subluxation or a issue with their shoulder where they're a little bit more loose, their muscle will compensate, cause more compression in their neck. which will thus create more systemic kind of like neck type symptoms there. All right, so in conclusion, kind of what we were talking about. So everybody presents differently. So a personalized program is what each person needs because everybody presents differently. You got to figure out what's driving the issues. So you got to find the root cause and find what the pain generator is. So we just talked about that in the very, very beginning. What the pain generator is what's going to ultimately allow you to figure what that is and then figure out a program specific to address that. Then a lot of times the symptoms just kind of go by the wayside. All right?
Thank you.
No problem. And I know there's a request to get people up and exercise. Do people want to get up and is there exercise? Chris, come on up here. So what I'll do is, people feel free. I'll show maybe a couple stretches that people can do per area, just in general. If you have symptoms, or again, I've assessed a lot of people in here, but not everybody. But I have not assessed everybody. So if you feel uncomfortable or if there's issues at all, just watch. But I'll show you guys a couple things per body part, and then we'll wrap. Sounds good? And then we'll open up to questions, I think, correct?
Yeah, that's good.
Yep. All right, so first thing we'll do, so shoulder neck, one of the biggest things that we run into is people will end up in this posture where they're looking down with rounded shoulders. So the first one or two things that we start with is getting the shoulders back. So if they have any type of neck symptoms, we can't get you better if you're stuck in this position. So we try to get the shoulders back, kind of pull the shoulders back, and get into that rotated position. Usually hold about 3 to 5 seconds. It's not up though. If people go up, what'll happen a lot of times is they'll actually aggravate the symptoms that they have. It's just straight back to get the shoulders back. So it usually feels pretty good. When I tell people to do this, only do this about 50% of your max. Don't do it as hard as you can because then you can strain your shoulder. The other thing is getting your arms up overhead. And you should gently start opening your chest and shoulders up. If you can't get your arms overhead, you can always cross your arms this way. And just gently lean on back. Because that's going to help, again, get you out of this position. So if you have rounded shoulders, so you don't look down all day long, you try to do this, but what that does is it irritates the neck because you compress. So getting your shoulders under you allows your neck to be in a neutral position. So that's pretty much a couple neck ones. I'll show you a shoulder one I think is very good as well. It stretches the posterior capsule, meaning the back of the shoulder. So if the back of your shoulder is tight, then it's going to affect everything from a position standpoint for your front of your shoulder, then posture up into the neck. So usually I'll have somebody come across, again, be careful if you have any shoulder issues, across their body. Hard to do with the suit jacket on, and then you're going to come across like that. So basically you're grabbing your elbow. George, you know this one from basketball. There you go. And then back the other way. So those are some good upper extremity ones. Some lower extremity. Do I have any volunteers lie here on the floor? So lying down, you can do a lot of them. There are a couple, which again, careful for balance, but to stretch the quads, I'm just going to give you a general quad one. You can do this on a table or on a bed, pulling back. You can do it standing, just kind of gently pulling the leg back. Just make sure if you have any balance issues that you're very, very careful. But it's a good one to kind of stretch the front of the thigh. The next one you can do from a chair, which is helpful. So I want to make sure everybody can see me. So I'll do it over here first. So seated. And I'll come on this side as well. Chest up. Gently leaning forward. You get a good hamstring stretch there. Most people will feel this pretty darn well. And then I'll come over on this side. But basically chest up, gently leaning forward. You're going to feel that in the back of the leg. So I'll come around on this side here. Another one is right here. So heel down, toes up, not all the way up, but just kind of in a neutral position. Gently leaning forward. You'll feel a stretch. Right in the back. So it's amazing what happens though if you just do generalized stretching. Your body typically responds well because as we age and just as we're more active, things will tighten up. And when they tighten up, they create more compression, you'll get good blood flow, and then kind of creates that cascade. So, final thing is find the root cause, and that's a way to approach it. If you don't find the root cause, you can just kind of snowball going a bunch of different directions. If you find the root cause, it really does make a world of difference. Thank you. Question? Let's bring this back. Questions?
You said that peanuts were among the things that contribute to arthritis. Is that true of the tree nuts like walnuts and cashews and that kind of stuff?
So peanuts are one of the factors that can lead to
Right.
more inflammation, not necessarily that causes arthritis, just for clarification. And it is separate, the way your body recognizes tree nuts than it does peanuts.
Okay.
Peanuts is on the list, tree nuts, for some people are a reaction, but it's not on the top 7 list that you get rid of, because people typically on that diet will eat almonds, walnuts, because they need to have some level of food in their system. But peanuts are the one that the research states has the most responsive immune response. That's why there's so many peanut allergies, myself included, out there. But that's a great question. So it's tree nuts are a separate category than peanuts.
Okay.
Yes.
How about arthritis in the hands? Is there like any type of exercise or something?
Yeah, so, and that's a great question. So the question was arthritis in the hands. And I get that very, very often in the clinic. And it's actually something that you can do a lot of things with. So I'm actually going to demonstrate a couple things because it's very, very important. Actually, I just had a conversation with Dennis over here. It's like, you planted it. So, arthritis in the thumbs and in the hands. What will occur is people that use their hands a lot in general will get a lot of muscular tightness into their hands. Okay, they don't even think about it because they're just using their hands. They're not thinking about all the little muscles, the intricacies in their hands. But the goal is, and my mom and we do this often with, you go into the hand and you find a lot of these tender spots, like these trigger points within the muscles. These muscles tighten up, and when they tighten up, they don't get good blood flow, so they get achy and sore. So getting in there, making sure you do, one, you can do massage to it, but what we like to do in the clinic a lot of times is releases. So we can actually get right onto the area that causes the most discomfort and do a light pressure release, light to moderate. Actually, for us, we go a little bit more moderate, but in the beginning stages, if you're doing it to yourself, you might want to keep it to light. But find the spot, press on it, and what it does is it actually changes the form of that reactivity of the muscle to allow it to relax a little bit more. You do that a couple times, you can start getting a little bit of momentum there, just to kind of loosen that up. Then you want to make sure that you stretch the joints so you don't have that same compression factor going on. So you can stretch the fingers, stretch the thumb. You never want to take anything to the point of like discomfort though when you're stretching, because that can make things more aggravated. Then, this is more specialized, but taping techniques do extremely, extremely well, because what it does is, if you're locked up, say we're going to use thumb is a good example for you, thumb. So if your thumb is locked up, we go and do releases right into this. This is called your thenar eminence. This is where all the stuff that can happen with your thumb occurs. Release, 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 and then we tape it up, so if you get pulled back and it flares things up, it creates more inflammation, allows it time to heal. So when it's healing, then it'll, yes, you could still have breakdown in there, but it's not active inflammation, not actively irritated. So doing that, plus the releases, plus the tape, plus the stretches, and then we go into light stability to reactivate the muscles that aren't working. People do very well, actually. I have people avoid surgeries and that stuff based on that.
Can I use a brace?
Braces work well. Heating pads, they actually have vibration gloves out there that people like a lot. Like at the end of the day, you can do like a little vibration glove. I can look up the name if you're interested. But yeah, braces are good. Sometimes people like to wear night splint braces, because at night people tighten up and they kind of go into those positions. That helps kind of lift up there. But braces aren't bad at all, because they help. They do similar stuff as tape. They try to protect it, but then you go into some strength. Other questions? Sorry, I'm not really good with the mic. Any other questions?
Mine's more of a statement. Obviously, I heard about Dr. Crassas a couple of years ago. It was Father Theodore, who one day in church proclaimed him a healer. So I thought that was bull.
I agree.
When I couldn't function, it's not like I'm a box of chocolates anyway. I'm sure you all know that. But I went into Dr. Crassas, and I continue to go at least 2 times a week, and it's just incredible what he can do with bodies that are screwed up. And usually I go in there and say, Doc, today it's my knee. Now it's my neck the next day. And lots of times I feel like I crawl in and I walk out. So he has a God-given talent to do magical things with your body, and I strongly recommend it.
Thank you. Appreciate that. Any other questions? All right. Thank you very much.